Welcome. In this lesson we are going to discuss a case with extrusion. The situations with supra and vestibule position of teeth can be quite challenging for aligner treatment, and we are going to focus on this treatment with canine supraposition. The first thing to evaluate is the space. We need to be sure that we have enough space to put the tooth back into the row. So let's have a look from the occlusal view. This space between the incisor and the premolar. So as you can see, the premolar is rotated. So just by derotating that, we might gain the space, and also you can see there is spacing or tremor in between the canine and the incisor. So let's have a look at the movements. As you can see, here we need almost no bodily movement. Just by correcting the rotation, the angulation and torque of the teeth, we have enough space for the canine. Another thing we might consider, and what we have here, is the IPR. If you evaluate that, you will see that we have IPR in the frontal region for the incisors, and also in between the canine and the incisor, 0.2 millimeters that we need to gain the space. Now let's have a look at the movements once again from the right side, because another thing we need to evaluate is the height of the canine. Here it is located at the height of half of its crown, that is, we need to extrude it for the half crown height to bring back to the arch level. Now as for the attachments. To move these teeth we need a good retention points. At the same time, these attachments help us to derotate and extrude them. The attachment is of rectangular form with beveled edge. It provides a tighter aligner grip and a better movement control. We can see how the teeth are located in the end. We need to evaluate symmetry. Pay attention to the gingival level. You might need to use the grid to see that. In these cases, we might sometimes need the revision to perfect the nuances. Treatment time depends on the canine position. When a canine needs more derotation, the treatment might last longer. Here, as you can see, it's 23 aligners, that is about 11.5 months. One last thing to remember is the retention. Canines are subject to relapses and need to be fixed with a retainer. Let's have a look from the inside. Of course, normally we put the retainer from canine to canine. If possible, the fixed retainer may be prolonged till the first premolars. Be sure there is enough space for that when in occlusion. We can have a look at that in the model. Just click on upper and lower jaws together, and from the inside you can evaluate the space on the premolars on the left side and on the right side, so that there will be enough space for the retainer. An aligner retainer might not be enough for this kind of treatment. All in all, these cases might be challenging, but are treated well with aligners.